Welcome to the Dental Business Journal, Hygiene Edition. This is a weekly e-journal brought directly to your inbox. To subscribe, visit dentalbusinessjournal.org. In today's issue, we are going to explore the topic, how to optimize your hygiene schedule. You can also listen to us as a podcast on iTunes, Google Play, Amazon Music, or your favorite podcast tool. If you like video, subscribe to our YouTube channel, Dental Business Journal. I am Naren Arul Raja, your host for today's edition. Let's dive in. My guest today is Dr. Eric Block.
And Aaron, thanks so much for having me.
This is going to be a wonderful episode, Eric. We're going to be talking about hygiene, and our topic today is how to optimize your hygiene schedule. So the very first question I have for you is, what is the current state of hygiene?
Naren, I feel like we're in such an unprecedented time where we are seeing patients that are coming back into the practice. We haven't seen them in a couple of years due to COVID. They took a dental holiday and they're coming back, and they're also ready to do treatment. And they're available. Patients are available, as most of them either work hybrid schedule or fully remote. So they're actually available to come in during the week and put them where we need to put them. However, there is a high demand and a shortage for hygiene, for hygienists. So it's a tricky situation where we have the patients, we have the demand, but a lot of practices are feeling the stress of not having a good, solid team of hygienists. And a lot of dentists are having to go back and do their own hygiene. They're having to outsource to temporary hygienists. So in general, it's hard to find staff these days and to keep them. And to tell you the truth, Darren, it's not just dentistry, it's every industry, but for sure in dentistry, it's an issue with finding hygienists.
Absolutely. I think both the points, on one hand, like there's a lot of demand, and now the supply is kind of tricky with not being able to get enough hygienists to, fill the schedules. Thank you for that. What are some critical hygiene KPIs that a practice owner should be focused on?
Yeah, and first of all, a KPI is a key performance indicator, and it's something that's trackable. So for my practice, it's important, I feel, to measure hygienist data, such as treatment plan acceptance rate, the hygiene reappointment rate, periodiagnosis, treatment acceptance and reappointment. Then there's also auxiliary procedures such as fluoride or sealants or Arrestin. It's a great way to kind of measure up and see how the practice is doing. Because to tell you the truth, if you don't keep track, then you don't really know what's going on in your practice.
Why are these metrics important to track?
Well, the data doesn't lie. And if you don't know what's actually going on in your practice with data and measurable KPIs, then you're really just guessing. And it's important to follow the data. The data tells a story. And you can measure how each hygienist is performing, if they're getting patients to say yes to treatment, if they're getting a good, solid reappointment rate where patients are rebooking. And it's not a competition. It's really to measure and see who needs help. And you may have a team member, a hygienist that is really, crushing it with their reappointment rate and their treatment plan acceptance and doing a lot of auxiliary procedures, and another one that may not be. And let's find out who needs help and how we can help them. Someone that may be new and right out of practice, maybe their numbers are going to be low. Well, let's find out where they can use help. And the way to do that is through measuring the KPIs and see exactly where they need the help.
What are some ways a practice owner can maximize the typical 1 hour long hygiene visit?
Yeah, there's a lot that can be done in 1 hour. And I think that it's so precious, that 1 hour with that patient. Education, of course, is so important. Same day dentistry to me has become one of the most important things in my practice. If there's any overdue treatment, We're going to reinforce that treatment to that patient. And if I have time in my schedule, I'm going to try to get them over into my schedule. But figuring out who needs who has overdue treatment, and getting that treatment done. There's also great things that can be done in the hygiene room, such as scanning or taking impressions for clear aligners or bleaching or night guards. And of course, educating the patient on periodontal disease and taking photos. There's so much that can be done, that goes beyond just the typical hygiene visit.
Let me ask you the last question. What are some techniques that we can use to improve patient treatment acceptance? This is a good one, Eric, and I think we should end with this.
I think pictures are worth 1,000 words. Taking good photos, having a good intraocular camera is a great way to improve treatment acceptance. When you show a cracked tooth and you blow it up into a picture 10 times the size of their tooth, patients will say, wow, when can I get this started? They see that crack, they see that big filling, they see that recession. I even have sometimes hygienists take a photo with the probe in the pocket to show the patient. Pictures are worth 1,000 words, and I think videos are worth 10,000 words. We have videos that show patients the procedures. And a lot of times hygienists, they're tired by the end of the day. They are explaining procedures and treatment over and over. So I'll actually play a video of the procedure and show the patient, and that helps a lot to get patients to move forward with treatment. Role playing is important, reviewing with the hygienist difficult conversations, whether it's about insurance or about treatment, and know your fees. If a patient asks how much is bleaching or how much is a night guard or how much is scaling a root planning or a membership plan, it's important that everyone knows your fees and your systems, how much time you need, so that it's automatic, and there's less question marks, and you could get more patients to say yes.
Thank you so much, Eric. This was a wonderful episode with regards to hygiene, and I think our listeners would get a lot out of this. If you love what we do here at dentalbusinessjournal.org, tell your friends, share a review on iTunes or YouTube, and don't forget to subscribe. Till we meet again, I'm your host, Naren Arulraja.